Rivaroxaban is useful for treatment of venous thromboembolism in adults and is associated with lower risk of bleeding compared to standard anticoagulants. EINSTEIN Jr. Phase 2 used body weight adjusted Rivaroxaban for children with venous thromboembolism. It was a single-arm, multi-center study with 3 age groups: children younger than 6 months, those in age group 6 months to 5 years, and in children and adolescents between 6 to 17 years. Studies were done at 54 sites across Australia, Europe, Israel, Japan, and North America. The study was in children with confirmed venous thromboembolism who have been treated for at least 2 months with low molecular weight heparin, fondaparinux, or vitamin K antagonist. In children with catheter-related venous thromboembolism, the cutoff for previous treatment was 6 weeks. 89 children, that is 96%, completed study treatment. None of the children had major bleed. 4% had clinically relevant non-major bleed. There was no symptomatic recurrent venous thromboembolism. In 75 patients, repeat imaging showed resolution of thrombus burden. 43 had improved and 8 were unchanged. No patient deteriorated in this study. EINSTEIN Jr. Phase 3 was a multi-center, open-label, randomized study in children and adolescents up to the age of 17 years. The study was conducted across 107 pediatric hospitals in 28 countries. Children with acute venous thromboembolism on heparin were assigned to either body weight adjusted Rivaroxaban or standard anticoagulants. Symptomatic recurrent venous thromboembolism occurred in 1% of the 335 children in Rivaroxaban group and 3% of the 165 receiving standard anticoagulants. Improved effect of Rivaroxaban was noted on repeat imaging compared with standard anticoagulants. 3% of the children had non-major clinically relevant bleeding on Rivaroxaban. 2 major and 1 non-major bleeding episodes occurred in those on standard anticoagulants, 2%. There were no treatment-related deaths. Treatment with the Rivaroxaban resulted in low recurrence and reduced thrombotic burden without an increase in bleeding compared to standard anticoagulants. Thus, the safety and efficacy of Rivaroxaban in children was similar to that in adults. Here are the journal references.
Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.